Dave Vockel from Lighthouse. Hey, we're here to break the back of the heartbreaking cycle of chronic care patients from diagnosis to mid-condition to acute care. In the 10 minutes that I'm about to spend with you all, 2 people in the United States will die of diabetes. 1 person will lose a limb. 35 people will hear for the first time that they have diabetes, and that there's a 2 out of 3 chance that they'll have a heart attack because of it. If a typical patient gets about 8 minutes with their doctor in an appointment, in chronic care, resources flow to the acute, and you tend to get about 3. It's not enough. Lighthouse has partnered with the American Diabetes Association to break the cycle of diagnosis, mid-condition, acute care. We pull on 4 levers to get it done. Doctor-facing software that integrates into every major EMR that lets a practice manage a population like you'd manage an SEO campaign, with everything from risk stratification to remote monitoring. A patient experience, which is somewhere between boot camp and a graduate program in self-management. Health record platforms so that your whole care team can have full access to your health record, and most importantly, a team of wildly compassionate nurses and certified diabetes educators to help our patients on their journey. Our pitch to doctors is pretty straightforward. We're here to help you deliver better care to your chronic care patients. And there is a Medicare incentive for our program that means between $150K and $300K in bottom line money for every doctor in your practice every year. Let's be specific about the ADA. They are our #1 investor. They co-designed and vetted all of our doctor and patient-facing programs. They've already started to include us in their major health relationships, and right now we're trying to figure out what to do with 300,000 volunteers that want to walk into their doctor's office to talk about our program. After 18 months of program design, medical review, doctor testing, patient testing, we've been live for 5 days. In 5 days, we've closed 2 doctor practices. 2 doctor practices is 9 doctors. 9 doctors is 4,500 qualified Medicare patients that I will bill $600,000 against in the next 12 months and $1.2 million the year after that. 10 seconds. We had our first OAuth from a third-party EMR that is going to integrate our service as a native service. I hired 34 nurses last Friday. 2 seconds.
Thank you, Dave.
We are Lighthouse.
Thank you. All right, judges.
So, if you don't mind, I'll start out. So, very interested. Congratulations on going live. Congratulations on the first new customers. So
it takes a very long time to work with an association.
I do know that. So, we're DRX Capital, and we've invested in Omada Health. So, I love the fact that you're going after information that's been prepared by the ADA, good, sound medical baseline to it. When looking at your program, the one question I had is that right now Medicare just wants to get patients engaged in these type of management programs. But I can see a time in the future where they're going to want to have some metrics of, now that we're paying for this, what are we getting out of it? And I think that's going to be a key part of your program as you get volumes of patients to understand what the metrics are. So have you thought about that, and are you integrating that already into your software platform?
I appreciate the alley-oop. Artificial intelligence, computer science major back in the day, Yahoo behavioral ad platform. Our CTO is coming off of Zephyr Health, which is a healthcare predictive analytics company, and he was CTO of Stanford Hospital.
Okay.
And so we assume that the Medicare incentive is going to go away in 3 years, and we have to be ready to prove that it's worth significantly more before then. We think about it all the time.
So Dave, if I'm pre-diabetic and I go in and see my physician, how would this work for me?
If you're pre-diabetic, so the doctor gets paid and then we get paid for Medicare patients.
Okay.
If you're a Medicare patient, it's wonderful. It covers any chronic condition. It covers diabetes and pre-diabetes. The ADA is our lead marketing partner. We also have programs in heart, COPD, and other chronic conditions. And the ADA loves prediabetes because their mission is to stop diabetes, not treat it. We also have deals with all of our content partners that since only about 90% of patients are on Medicare, the other group gets it for free. So while we get paid on those 90% individual patients, and we pay some of our partners based on volume, we don't have to pay for the free customer, for the patients we don't get paid on, but we don't want the doctor to have to make a decision of who do I offer the program to and who do I not.
And then maybe to follow, it's a big believer in this segment. We made an investment a few years ago with Medtronic in gluco, so also strong believers in the importance of access to patient data and dashboards for physicians. How are you thinking about the segment of the physicians or hospital networks that you're going to be targeting?
The independent physicians, so the good thing is Medicare data is public. So I can look at any single doctor and know exactly how many Medicare patients they bill against. So my first couple of calls were to the doctors that bill 1,000 Medicare patients. Independent physicians tend to be in a lot more control of their office, and they get to eat what they kill, where if you're an actual employee of Sutter working out of their offices, this additional revenue stream, which is kind of an accelerant, is not as interesting to you. However, Sutter just tried to do this, and it failed. And we're in one of the 2 finalists to take that over for them because it's hard work.
Okay.
So I'll just jump in. I know you, and I'm so excited to see you again. In all transparency, I met Dave through another box initiative that we were doing on patient education, and I love the progress that you've made, and it's wonderful to see. So I think, and I know Dean as well, so I think what would be really helpful is if you could just summarize what the workflow is for a patient and a doctor who's using this platform.
Yep.
And how the doctor's paying you, and given that you're going to get paid on the Medicare or chronic care, right?
Yes. Yeah.
Piece.
So the work to prep for a patient can be done by anyone in the office, and we have a standard set of patient plans that they can approve. The doctor doesn't have to do anything. In the appointment, a nurse or even admin can spend 5 minutes with a patient and explain, we're going to make your information available to the rest of your care team, and you can call us anytime to withdraw the service, and here's the phone number you can call to get 24-hour support, and a nurse and a certified diabetes educator is going to call you. And so the integration into the EMR is every Monday morning they can print out all the patients coming in this week and the gap of those patients against the ADA standards of care, to make sure, like, right, I need to ask them if they've been to the dentist, or, oh, it's, you know, they're out of compliance for getting a foot exam. And then I have an audit sheet that I give them that lets them bill Medicare. And I'm almost always sitting on an audit sheet worth more than what they owe me. And so, you know, month 1 with them, I bill them 10 grand, and within 30 days, I'm holding a piece of paper worth 15 grand to that doctor, and
Got it.
we'll trade.
How does that work? What is your business model in terms of you're allowing the physicians and the providers care team to bill Medicaid on patient care and patient monitoring and education? What's your business model in terms of selling to those physicians and hospitals and providers? Is it
So
a
our
SaaS-based?
go-to-market?
Yes.
Oh, yeah, so it's $20 per patient per month. So they bill Medicare $42.
Right.
We take 20 of it.
Okay. Thank you.
Yeah.
All
Just
right.
one last question. So I get all the guidelines and I get the audits and the checklists. How is this being appified? And is there a dashboard or a mobile app for the patient, as well as calling and so forth? But how are you actually automating all of this?
Yep, so the patient experience is a mobile app that has taken the AD library and reimagined it into 2 to 4 minute patient experiences, organized around recognized areas of diet, physical activity, adherence, and writing stuff down.
Got it.
We've also taken all their content and voiced it over to address the low literacy group. Because even if you can't read above a first grade level, you can comprehend at much higher than that.
Dave,
Yeah,
thank you. I'm sorry.
there's so much more good stuff.
Yeah.
We're out of
It's really
time.
helpful. Great.
So thank you very much.